Well, joining me now is Dr. Katy Kamkar, clinical psychologist at the Center for Addiction and Mental Health. Welcome to the show, doctor.
Thank you very much for having me.
Now, let's start by highlighting some of the ways this pandemic has affected the mental health of Canadians.
Such an important topic, definitely. We do know that the mental health needs of Canadians have been on the rise. And we have very helpful surveys and data available. And we do know we need to engage in constant and continuous data and research to be able to inform organizational strategic priorities, the health system protocols, and the government policy, and to be able to maximize all the resources and support and the needs of Canadians. We do know from all these surveys that have been gathered from CAMH in partnership with Delvinia from, let's say, May to December 2020, we know, for example, that women, younger adults, and parents have been disproportionately impacted by the pandemic. Certainly, we know younger adults, especially 18 to 39, or over 24% of respondents do report moderate to severe anxiety levels. We know that also depression, as well as loneliness, have been present throughout as well. Respondents with younger children, so children below the age of 18, also report higher levels of anxiety than respondents who do not have children within the age group. The other helpful finding is over a quarter of Canadians do report engaging in binge drinking, and that has been the case throughout the pandemic. So when we look at, again, the increase in terms of depression, anxiety, the binge drinking, loneliness, certainly the mental health needs of Canadians have been on the rise.
Some very somber information there, Doctor. Now, looking back at previous disruptive events or crises like the 2008 financial crisis or the Fort McMurray fires in 2016, what are the long-term mental health effects following events such as this?
Thank you for that important question. We do know, let's say this winter, we do know the depression will likely be very high. And that's really because of the already unprecedented increase in depression as a result of the pandemic. In terms of the long-term impact, this is unknown at this time. And that is why we need to engage in continuous research. And certainly CAMH has the plan to engage in future research, as I had mentioned, for us to have a better understanding of what are the needs of Canadians. And we always encourage Canadians to seek mental health support because it is effective.
And what supports are already available for Canadians that are looking to improve their mental health at this time, Doctor? And more importantly, are they free? We've got about a minute and a half left, ma'am.
Yes, thank you. I think that it's always great to look at great resources and education and self-help guides that are right now available. There is camh.ca/COVID-19 website. Great materials, educational tools. There is also Access CAMH that is available as well, where people can call. People can always visit their general practitioner, the family physician, for support that demands self-referrals, but a lot of other resources and departments as well, where it can also be self-referral as well.
All right, ma'am, we've got about over a minute left, but something that comes up a lot here on Forum Daily when we discuss the issue of mental health is the need for a national universal healthcare plan in Canada. So my question is that a realistic goal? And if it is, what would that look like? About 45 seconds left, ma'am.
I think that is the reason why we need to engage in continuous research and data. We are talking here about before the pandemic, during and after the pandemic, with a focus on mental health promotion, on prevention, and on treatment. Definitely, we want to ensure that everyone has access to care and to resources. We really want to maximize that. One thing that was available prior to the pandemic, but it has increased by over 3,000%, some of the data has indicated, is the virtual therapy, the video therapy, the telemedicine that really makes it accessible to everyone. No concern about the commute or, let's say, costs related to the commute, and it makes it more accessible as well. And we do know that they do work, and that is why we encourage everyone to engage, again, to see any professional mental health for support. As I had also mentioned, the continuous data gathering to inform, again, the organizational strategic policies, strategies, and to the health system protocols.